Jocelyn, and we are going to go over some joint ranges of motion and end feels. So let's begin. Glenohumeral joint here in the shoulder, we got flexion. The end feel is going to be a muscular stretch, and its full range of motion should be about 180 from hanging. In extension, the range of motion decreases to around 62 if fully extendable, and it should also be a muscular stretch or capsular end feel. Abduction, straight up, is going to be around 180, and it will be a capsular end feel. And normally adduction would be blocked by the body, but if we are moving the arm in front, then its range goes to about 50 degrees and has a muscle stretch or capsular end feel. For internal rotation and external rotation should both be around 90, and both should be a muscular stretch end feel or capsular end feel. Sometimes people have a little bit more external rotation that goes past, and sometimes that can become problematic. So next we'll go to the elbow. The humeral ulnar joint here in the elbow, flexion is going to be a tissue approximation end range, end feel, and about 140 degrees of flexion, and extension will be a bony block end feel, and normally 0 degrees extension. Some people are hypermobile, like you see here, with maybe 1 or 2 degrees past 0. So if you go ahead and lay down and do the hip stuff. Down. So hip joint flexion is going to be with the knee relaxed, so the hamstring isn't involved. It's going to be about 120 degrees with a capsular end feel. Without having her flip over, we'll go to abduction. Hey, just stay on your back. Abduction will be in the 40 to 50 range and have a capsular or ligamentous end feel. And if you actually roll on your side like you were, adduction, you're kind of on your side so that I can move your leg up. Put your leg in front of you like that. Hip adduction will be around 20 degrees and have a capsular end feel or be blocked by the other limb. Roll over on your back, or on your stomach, so I go prone. Hip extension is around 30 to 40 degrees in a healthy person, coming straight back and having a ligamentous or capsular end feel. And internal rotation is going to be around 40 degrees with a capsular end feel. External rotation around 30 degrees with a capsular end feel. I'm sorry, 50 degrees with a capsular end feel. So that's the hip. The knee joint is going to have about 140 degrees of flexion with a tissue approximation end feel, and should have 0 degrees extension with a capsular end feel. Some people, again, are hypermobile in their knee, just like in their elbow, but there's no bony block of the olecranon process in the knee like there is in the elbow. So some people can have a little bit more, 3 to 4 degrees of hyperextension in the knee. So go ahead and pop up. For the wrist, extension is going to be around 75 degrees, and flexion will also be around 75 degrees with a capsular or ligamentous end feel, and ulnar deviation will be in the range of 35 degrees with a ligamentous end feel. Radial deviation not quite as drastic with the end feel. It's also ligamentous and about 20 degrees of range of motion. So now we're going to do some assistive, passive, and active ranges of motion for shoulder flexion, knee extension, and ankle dorsiflexion. So first I'm going to have her do some shoulder flexion. So come straight up like that. Come back down. So this is all active. And one more time, I can observe from the back. So this can go one of two ways. If she had no pain, then I could go ahead and have her do a, I could check her painful arc with resistive range of motion, or I can check for, I can help her if she had weakness in any way with active assisted range of motion, which would be me maintaining good alignment of the joint and scapula, and we together raise the arm up. Then if she had major weakness, I would do this passively just by bringing her arm up through the full range of motion without any effort by her. So let's sit up here. So knee extension, as you can see here, she has a bilateral scar on her anterior kneecap, just below the patella, where she's had ACL surgery. She's a track athlete. So go ahead and extend your right knee for me for active, normal, and then if she had no pain or I was suspecting some pathology with no weakness, I could have her push against my arm through the range of motion for resisted. Then for active assisted, we would together bring the knee up, and I would, for passive, I would bring the knee up gently and look for any abnormalities. Ankle dorsiflexion, same thing. I'd have her bring the toes up towards your kneecap as far as she could. Very nice. If there was any weakness, we would do this together. And if she was unable to move it, then I could test her range of motion passively by having her relax and testing the stretchability of the gastroc muscle. Okay, so now I'm going to look at some ranges of motion in her knee, which she actually has told me previously to this video being made that she has some problems with knee flexion. As we can already see, she has maybe a very small amount of hyperextensibility in her knee joint here. Let's see. So with the goniometer, I'm going to put this on the lateral femoral condyle and line up the other head with the hip joints, and the other head with the bottom head with the malleolus. And she has about 2 degrees of hyperextension. If you want to lay down, or lay on your back, you can check her flexion. Line the goniometer up in the same way. So go ahead and flex your knee for me all the way up as far as you can. She has around 125 degrees, and if I passively push her a little bit more, I can get it to 130. So as you can see, here is her scar. She's had ACL surgery. Have you had anything else in this knee?
Fractured femur. Meniscus.
She's also fractured her femur and had meniscus surgery. So it might be pretty difficult to get any more flexion out of that, but the main goals would be to increase the flexibility in her quadricep and increase the strength in her hamstrings, as well as most likely doing some joint mobilizations to increase the mobility of the joint capsule around the knee itself. So, yeah. Again, this is my friend Jocelyn. Those were her joints, and thanks for watching.